Is it possible to undergo hair transplant if somebody having diffuse thinning? Answer is yes. You can go for hair transplant if you are having diffuse thinning, but hair transplant is not the only solution. This is not because of your hair that you have lost. It is more important to also to protect the existing hair. There comes the role of medical treatment. So if you are having diffuse thinning, the best answer is it's a combination approach. Hair transplant for your lost roots, but you have to protect the existing hair by adequate treatment with the medical treatment. That includes your conventional finasteride, minoxidil and sometimes maybe PRP to give some additional benefit. So that will stabilize the hair loss, will protect the roots, and in the meantime we can go for transplantation. But without stabilization, without medical treatment, if you are going for hair transplant in this case, then you will keep losing your native hair which are subjected to this process of baldness, and you will get result, but in due course your existing hair may undergo this thinning process. That's why it's important for medication to stabilize the hair loss and along with hair transplantation. In such type of condition, there is an important term you should be aware of, that is known as shock loss. So what is shock loss? In shock loss, what happens? So when we do surgery, there is some form of trauma in terms of anesthesia, effect of injections, and as a result of this, some people with diffuse thinning may rapidly shed existing hair, and in fact after few months that area may look worse than the previous transplant. So this is because of the shock loss, and it is more common when we have done surgery in diffuse thinning without stabilizing the hair loss. But good part is shock loss is a transient event, and to prevent the shock loss or to minimize the shock loss, what we do, we adequately stabilize the balding process with medication, and during surgery we use very fine needles to have the minimum trauma, and also sometimes we use PRP which also gives additional boosting. Not doing dense packing, these are the things we take care to prevent shock loss, and even if after that you will develop shock loss, so it is completely reversible. Post transplant you have to be regular on finasteride, minoxidil along with good protein diet and any form of supplement that will give some boosting and nutritional support to the roots. Then look at this patient. This is a case of diffuse thinning with grade 5 baldness with some amount of significant existing hair. He was on medical treatment for a year and his baldness was stabilized. Then we planned around 4000 grafts with a combination of scalp and beard, and you can see this is the result after 6 months. This is a good coverage and well preserved existing hair. He doesn't have any hair loss at this stage, and the result will improve further. The idea is, in case of diffuse thinning, it's not about coverage, it's about coverage along with preservation of the donor for the future requirement and conservative management, not very aggressive. This is the case 2. He is 26 years with medical support for last 2 years, but front area receding, and this is the area which usually doesn't respond to medical treatment and bit resistant, and this is the result after a year. You can see good hairline with good coverage and frontal, significant change in the frontal look, and he is continuing the medical treatment. Hair fall is also stabilized. This is another case, except other than the receding hairline, rest part of area there was a diffuse thinning. Again he was on regular on medication for 6 months, and he was planning for surgery because it was affecting his confidence, and he was planning for the marriage. And after stabilization we planned for around 3400 grafts, and this is the result after 1.8 years with a good coverage of the transplanted area, and he is regular on medical treatment. This is another case. He is 28 years male with diffuse thinning. He was regular on medicine for last 1.5 years when he planned for the surgery, and we covered the whole scalp with around 3800 grafts from the scalp and few beards because he was young. So plan is to preserve the donor area so that in future, suppose in spite of medical treatment he will lose hair, then you will have adequate reserve. Again we have beard also to cover the whole area if at all required in future, but at this stage at 7 months the coverage is very good. This is again 30 years male with diffuse thinning along with a receding hairline. He was on medical treatment. When he came to us for the consultation first, he was having hair loss, and I gave him medicines, and after 6 months he underwent hair transplant with 3300 grafts with hairline and the frontal and part of mid-scale coverage, and this is the result after 11 months with a good coverage and nicely designed hairline and with a significant change in the look. So in summary, if you are having diffuse thinning and you are planning for a hair transplant, keep this point in mind. You need a combination approach of hair transplantation along with medical treatment to support to stabilize your hair loss. And while doing hair transplant, we have to be very conservative to protect the existing hair and also to have preserved some donor for the future requirement if at all.